top 10 indicators of a silent heart attack that you should pay attention to and not overlook. Typically, when you envision a heart attack, you might picture someone clutching their chest and collapsing suddenly. However, a silent heart attack is far more subtle and challenging to identify. This form of attack often presents no discernible symptoms, leading many individuals who experience a silent heart attack to remain unaware until additional testing uncovers the reality. How prevalent is this phenomenon? Out of approximately 805,000 heart attacks occurring each year in the U.S., around 170,000 of them are silent, posing a significant risk due to their potential to go unnoticed and cause considerable damage. Left untreated, they can prove fatal. However, there are specific warning signs that can help determine whether you are at risk for a silent heart attack. In today's video, we'll be discussing the top 10 warning signs of a silent heart attack that you should pay close attention to and not overlook. Number 1. Jaw, neck, or upper back pain. When it comes to recognizing the signs of a heart attack, most people tend to associate chest pain as the primary indicator. While chest pain is indeed one of the main warning signs, it's not the sole one. In fact, many individuals who have experienced a heart attack have reported feeling pain in their neck or jaw before other symptoms, such as shortness of breath and nausea, manifested. This occurrence can be attributed to the intense contraction of your cardiac muscle during a heart attack, which exerts considerable force. Consequently, this stress on your bones and ligaments can lead to discomfort or aches in your jaw or neck. Number 2. Excessive fatigue. Experiencing excessive fatigue, where you feel tired persistently, is among the early warning signs of a heart attack. In a study conducted by the American Heart Association, which examined 515 women who had suffered a heart attack, it was discovered that 70% of them reported experiencing unusual tiredness prior to the event. This fatigue occurs because during a heart attack, there is increased stress on your heart as it attempts to pump blood while the blood flow is obstructed, leading to feelings of tiredness. While fatigue could be attributed to factors like workload or changes in sleep patterns, if you're feeling consistently tired without an apparent reason, it could be a potential indication of a silent heart attack. Number 3. Squeezing chest pressure. When you experience chest pressure, it often signals an issue with your heart. This discomfort, also referred to as anginal or substernal chest pain, typically manifests as an uncomfortable squeezing sensation in the center of your chest. It may resemble a cramp and can persist for several minutes at a time. If you ever encounter this type of chest discomfort, it's crucial to take prompt action to minimize the risk of permanent heart damage. It's worth noting that other causes of chest pain unrelated to the heart could stem from issues with the esophagus, lungs, stress, anxiety, or musculoskeletal injuries. Number 4. Sweating. While sweating is a natural bodily response to feeling hot or during physical exertion, experiencing excessive sweating even when you're inactive or in cold weather could indicate a more serious issue, such as a heart attack. When your arteries are obstructed, it requires more effort for your heart to pump blood, prompting your body to sweat more in an attempt to regulate body temperature during this heightened exertion. Therefore, if you notice that you're sweating more than usual, especially when combined with other warning signs like nausea, dizziness, and lightheadedness, it's essential to seek medical attention promptly. Number 5. Bloating, nausea, or poor appetite. Feeling bloated or experiencing nausea, along with a diminished appetite, could be indicative of heart failure. This occurs due to fluid retention and inefficient pumping of the heart. As a result, the volume of circulating blood decreases, redirecting blood flow from the digestive system to vital organs like the brain. Over time, this can lead to weight and muscle loss. If you notice sudden changes in your appetite without an apparent reason, it's advisable to seek a checkup. We've reached the halfway point of our list, and we hope you found it informative thus far. Don't forget to subscribe to our channel, like this video, and hit the notification bell for more content like this. Let's continue with the video. Number 6. Lightheadedness or dizziness. During a heart attack, your body is deprived of oxygen due to blockage in the blood supply to a specific part of the heart. Consequently, your heart struggles to pump enough blood to meet the body's needs, resulting in impaired bodily functions that can make you feel lightheaded or dizzy. However, some individuals may experience dizziness as a symptom without any other accompanying indicators. In such cases, stress or dehydration might be the triggers. Nevertheless, it's important to consult your doctor if the sensation persists to rule out the possibility of a more serious underlying cause. Number 7. Difficulty breathing. Apart from the rhythmic beating of the heart, the automatic inhaling and exhaling of the lungs often go unnoticed by most people. However, when this process is disrupted, it becomes markedly apparent. Shortness of breath manifests as a sensation of being unable to breathe efficiently. The lungs may feel heavy, or the individual may feel the urge to breathe rapidly and shallowly. While shortness of breath can result from factors like anxiety, anemia, or allergic reactions, the underlying cause typically involves issues with the lungs or heart, and it's more commonly experienced by women. Regardless of the cause, shortness of breath should never be disregarded as a symptom. Number 8. Swollen legs, ankles, or abdomen. Swelling occurs due to fluid buildup in the body during a heart attack. As the heart loses its ability to pump blood effectively, blood can accumulate in the legs, ankles, and feet, resulting in edema. Additionally, the disrupted blood supply to the kidneys reduces their ability to eliminate sodium and water from the body, further contributing to fluid retention. Swelling is observed in approximately 20% of heart attack cases, making it an important indicator. If you notice these signs in yourself or someone else, it's crucial to act promptly. Seeking medical attention as soon as possible increases the chances of preventing further complications from a heart attack. Number 9. Persistent flu. If you find yourself unable to shake off the flu, it might serve as a warning sign. Studies have indicated a link between influenza and an elevated risk of heart attack and stroke. A study conducted in 2018 discovered that the risk of a heart attack increases sixfold within a week of contracting the flu. While the flu itself typically doesn't directly cause a heart attack or permanent damage, it could suggest underlying issues in your body that predispose you to heart disease and other cardiac problems. This is especially concerning if it coincides with an increase in your regular heart rate, shortness of breath, or other symptoms of heart disease, such as chest pain or pressure. Number 10. Trouble sleeping. Yes, difficulty sleeping can indicate underlying issues. A study published in the journal Current Cardiology Reviews revealed that individuals experiencing restless sleep are at an elevated risk of heart disease. During a heart attack, the left coronary artery may become blocked due to the accumulation of fat or a blood clot. This obstruction prevents adequate blood supply to certain parts of the heart, leading to malfunctioning in specific areas of the left ventricle. In response to this, the body releases alertness hormones such as adrenaline, noradrenaline, and cortisol. These hormones can trigger various bodily responses, including difficulty sleeping. Therefore, if you find yourself unable to sleep peacefully and spend the night tossing and turning in bed, it could be indicative of a serious issue. When it comes to your heart health, even small indicators matter. Heart attacks remain one of the leading causes of death globally. However, adopting healthy habits such as maintaining a balanced diet, regular exercise, and avoiding smoking can significantly reduce your risk. If you experience any signs or symptoms and are unsure whether they warrant concern, it's best to consult your physician. Taking any risks with your health is not advisable. If you suspect you've experienced symptoms of a heart attack, it's crucial to seek help promptly, even if the symptoms don't initially appear severe. Quick action could save your life. Did you find this video informative or helpful? Let us know in the comments section below. Make sure to subscribe to our channel so you don't miss out on future videos. Don't forget to like and share. Stay healthy.